to what does, as a trichologist, what does a proper trichologist consultation, what does it look like? What are the things that should be done when a person comes with hair issues?
So you're not just walking into an office, or you're not just walking into a space. First off, confidence. The work we do, we don't just give you products. We help you rebuild your self-esteem and confidence, because it's really painful where you used to flaunt your hair and all of a sudden you become a shadow of yourself.
Yeah.
So it's a safe space. I call it more like a therapy session, and it's more like a relaxation session, whereby you come, we test your hair strands, we test your scalp, we test the follicles. We personally ask, we go as far, now let me tell you, we go as far as seeking your medical history.
Yes.
Do you understand?
Yes.
Because sometimes medication can also play a major role. So we go as far as seeking your medical history, we want to know what you've been up to, the kind of medication you've been, and then we collaborate with medical experts on that aspect too, to help. You understand? So it's not just I'm going to the salon to wash my hair. No, you're coming to a safe space where we need to actually help you gain your confidence, talk you through the process, give you products. I don't leave any clients for my staff. I treat every person that comes. I treat follicles. I treat your strands. Our treatment starts from the scalp, because if you're going to harvest, it's from the roots. If you want to water a flower, it's from the roots. So we have to go down to where it's coming from. Sometimes if the condition is beyond us and we need like something very swift, we sometimes advise you to cut your hair. People go as far, and I want to say this thing, people go as far as going for steroid injections on their scalp.
Wow.
Yeah. And yes, because some treatments might warrant you to do that. There are some trichologists that will also advise you to do that. But I always tell people, do what works for yourself. You should go the natural way first before needling, because a lot of people now are left with scars on their scalp. And now when there's a scar on your scalp, that area, hair doesn't grow because it's a scar.
Yeah.
It can't grow.
So you've damaged it.
So you have different needle punched on your scalp, and the chances of hair growing around there is slim. So we usually advise people, do not go. You can go for a session with a trichologist, but don't allow injections.
Don't be so swift.
Because every consultation has their own packages. I'm not trying to run any other, you understand, but it's just reality. And then the implants that they are doing now too.
So we're gonna go into that, but let's go on a quick short break. But before that, just give us a quick thing. How is it important in early diagnosis? Because I do understand that there's something called permanent hair loss.
Early diagnosis might actually prevent permanent hair loss, except even people who are going through cancer therapy, they sometimes gain their hair back.
Yes.
So with lifestyle, I am always talking about lifestyle, talking about early discovery on how to help yourself. The moment you discover that this thing is going to be like this, change your lifestyle. You have to, use products, and you have to be consistent. You can then jumping from one product to another. Somebody's collecting. You use this today, it did not work. It doesn't work that way. So you have to go with what works for your hair type, and then stick to it. Don't jump from. It doesn't and then just give your time. The truth is, when you start using a product and you start checking your time, it doesn't work that way. So if you come for consultation, my question would be, are you going to be patient with us, or you want to pressure me? If you want to pressure me, don't come. I don't want, my hair is not working after 6 months. Most definitely, you'll see results. So while you're doing that, also hairstyle. You have to be careful with the kind of hairstyle you expose. I usually encourage my clients to wear wigs when they're under treatment. Stay away from weaving and doing braids and all those hairstyles, because your scalp needs to breathe. It needs to rest, you understand? So we just tell you, find a nice wig, not frontal, do DD. You know this?
I was told that DD grows.
Yes, it makes your hair very thick. Apply your product on your scalp every day. Use your DD. When you want to go out, use your wig. If you're not going out, leave your hair. You're inside your house, so just let the under be neat. If I remove my wig, you see how nice my cornrows is. So I don't compromise on that.
Wow, so we've heard a lot, and we're going to definitely hear a lot more. We're going to go on a short break. Do not go anywhere, because this message is actually for you. Yes, right there with the hair shedding and hair loss. Do not go anywhere. This is still the body care segment on Health Monitor. We'll be right back.
Health Monitor, your guide to good health. It's Health Monitor, the #1 health survey.
Welcome back, guys. This is still the body care segment on Health Monitor, and we're still talking about hair loss in both men and women. And I'm still with the beautiful trichologist Glory, and she has, yes, I've caught strays. It's my fault, and everything you said just borders on lack of information, lack of patience. Because I cannot even disclose on air how many hair products have jumped from one thing to another.
Okay.
Yes. But before we went on a short break, you mentioned transplant, if I'm not mistaken. Implants. Now, it became a sensational...
At the moment.
Yeah, it's a sensational procedure, but I like that you explore natural first.
Yes.
Patience before we start diving into needling, and you spoke about scars. Please, can you tell us your POV, what you feel about, honestly?
POV?
Yeah.
For the implants, after going through all that procedure, you still come back to products. You still come back to products.
Sometimes it doesn't work.
The products.
No, the implants.
That's what I'm saying. Because you go through all that thing. It takes like 12 months for some people to heal. For some people, yeah, it does. Because at some point, I was following I was actually following. There's nothing here that I don't really go and check those that have done it to see how far. So it works per se. But you still have to infuse products on your routine. And they will advise you to be consistent using your products. So at the end of the day, do you get what I'm saying? Why don't I just stick to these products are made? I can brag about mine if you meet me for the first time. Hi, what's your name? My name is Glory, and I run the 9 Days Organics. My products are made from edibles. What we eat. So when you go through these surgeries, they will still tell you to eat. Oh my God. You see, the problem I have is, good girl, I should have been making money. I should have just opened a clinic and be bumping Zobo for people that wants to pay. When you go through these surgeries, they will do the implants, which is fine. Like I said, what happens in the other world is not wired for us here, because we're already blessed with these things naturally.
Yeah.
So they now tell you, eat this, eat that, eat this. Those things that you're asked to eat are the things that I still have infused into products that you apply your hair. So if you come for consultation, I'll always tell you, try to, which is the lifestyle, feed on this, feed on that, and then use your products. So we have everything naturally that is not fertilized, which we are blessed with. So when they do it in those countries, I can relate with them because they're injecting those nutrients into your scalp, into your hair. You get what I'm saying? I might be wrong, but with what I've seen, the procedure I've seen so far. So imagine when you are diligent in doing that for 12 months.
So if you can be diligent and be patient for 12 months,
you'll see your results. But it's, but we like
quick fix.
And then we like when it's colored, packaged, and we believe in it. I think I need to go and color.
No.
The world is evolving. We don't like truth. No. We don't like truth. We have it. If you go to, how many Indians have you seen doing that stuff?
Yeah.
It's always from that fashion country. The country that builds fashion. They sat down and looked at it. But guess what? The people that that goes for those stuff are still we. Hardly them. Very few.
So we're the guinea pigs.
Okay. Are you seeing?
Guinea pigs.
So it's still very possible that it works for them. We talked about a product which we mentioned.
Yes.
Those products worked for their hair type. It's possible that these herbs might even be too harsh on them because their hair
work for mine.
Those products will not work for us.
Yes.
It will not.
When I lived in Asia, the products did not work for me.
Are you saying?
Actually, I had to sustain my hair through braiding, and then I had to my dreadlocks naturally formed.
So, it doesn't work for us. It's just like we're exposed, we're built in that system, right? If somebody sees you eating eba in the morning, it might freak out because you are used to English breakfast. But some people here, if I eat that English breakfast, I might faint before noon. Because you get what I'm saying? But there are some who are built with that gari that will last them the full day. So you now carry such a person and expect the person to survive or work, function well with just a slice of bread and cup of coffee? No.
Cup of coffee.
It doesn't work. So it's the structure we are exposed to, and we get it naturally. I have a farm where I have some of these things. I go and pluck. It depends on the client. I have very intense clients. I don't post a lot on social media. I have a problem doing that because they want to be private. So I will not throw them. Because the moment they remove their wig, some people might run. There was one that asked her, did you have fire accident? No. It wasn't fire accident, it was fungi.
Wow.
You see how far?
Wow. Wow. You need to go to a trichologist. Everything is not just it's not normal. Please take us through this sensational thing that is being sold everywhere called texturizers. Because I think I've fallen victim of that. Because I've been told that texturizers are better than relaxers. That it's better for you to texturize your hair than to relax your hair.
So what was the experience?
There is a moment of truth. It contributed to my hair loss drastically. I think it ×3 my.
And some people might even bite you for saying your own part of the story because
my hair became thin,
very thin, and you experienced tone growth.
Yeah. Became thin, and when I pull my hair, it snaps.
It's not for our own hair texture, like I always say. These things are built from there. It works for them because they already have stretch texture. they already have straight hair. So even if theirs fall off, they have extensions to cover up. And you think that, oh, her hair is 30 inches long, her hair is 20 inches long. But they are not living their truth to an extent. These things are rather, if you ask me, between relaxer and non-relaxer, right? Or if you tell me texturize my hair, I will advise you to relax your hair, because we know that you have left natural. You are now focusing on relaxed chemical.
Yes.
And with that, you double or triple your maintenance effort. But the one texturizer is either here or there. So it's being deceitful, because you don't even know if you should focus your energy on tripling your maintenance, or you understand? They just made you feel like, oh, texturizer is still like you maintain. No, it's not. This is me personally. I've said this several times. This is me personally saying it again. Texturizer is not safe for those of you that want to keep your hair natural, maintain your virgin hair texture. It is not safe. Anybody from anywhere will come and tell you it worked for them. Good for them. But for me, with the 70% of clients I've had, what was the first question I asked you? The second question was, did you relax or did you texturize?
Yes.
It's either, but for relaxers, they don't complain, because if you relax and you make sure that you deep condition your hair often, you won't have excessive hair loss. But texturizer will chop your hair and then will stunt your hair growth, and it make it shabby and sharp.
Yes.
You won't have that lush or luxury texture.
I showed you my video.
Yeah.
Beforehand.
Yeah. So it's not. There's no filter to that. If a brand feels bad about it, work on your brand. It's not for our hair. It's not for our hair type.
You said what you said.
There was a client that used texturizer, and she was bent on relaxing. So they told her not to use relaxer. Instead, use texturizer and a conditioner, so it can reduce her hair no grow. 4 to 5 years, same level. She cut the hair. So there's no filter to that. If it works, for good luck, but for what I've seen, I will, from my own view, avoid it.
I actually second that, because I deep conditioned, I steamed my hair, and in that moment when I would deep condition or steam, in that moment, my hair wouldn't fall out. But then give it 6, 7, 8 days.
You start falling out.
It starts to fall out.